Good afternoon, everybody. It is Saturday, May 20th, 2023. My watch says it is 3:42. My phone says that it is 3:44 in the afternoon. Okay, so this is part 6 of the preface of David D. Burns, MD, the Feeling Good Handbook. The second approach, bibliotherapy without other therapy, has been recently evaluated in 5 published studies over the past decade. Conducted by a team of investigators headed by Dr. Forrest Scoggin from the University of Alabama. These researchers evaluated the effectiveness of my first book, Feeling Good, the new mood therapy, as well as Dr. Peter Lewinsohn's Control Your Depression as a self-administered treatment for depression. Their first study was published in the medical journal, The Gerontologist, and the next 4 were published in the prestigious Journal of Consulting and Clinical Psychology. To make a long story short, the investigators concluded that Feeling Good was as effective as a full course of individual psychotherapy or as treatment with the best antidepressant drugs. Given the tremendous pressures to cut healthcare costs, this finding is of considerable interest, since a paperback copy of Feeling Good costs less than 1 day of antidepressant drug treatment, and is presumably free of any troublesome side effects as well. By the way, I don't want you to get panicky and think you are reading the wrong book. Although all these studies were conducted using Feeling Good, the Feeling Good Handbook is 10 years newer and should be at least as effective, if not better. The Feeling Good Handbook shows you how to apply these new methods to a much broader range of problems. These include depression, all the anxiety disorders, and interpersonal conflicts as well, such as how to repair a troubled marriage or get along with an overly critical boss or colleague. What did these bibliotherapy studies demonstrate? In the first study, Dr. Scoggin and his colleagues, David Hambling and Dr. Larry Butler, randomly assigned 29 adults with mild to moderate depression to one of 3 treatment conditions for a 4-week period. The researchers gave the depressed individuals in the first group a copy of Feeling Good and asked them to read it within 4 weeks. This was the Feeling Good bibliotherapy group. The researchers gave the patients in the second group a copy of a book that was not expected to have any antidepressant effects. It was Viktor Frankl's classic book about concentration camps, entitled Man's Search for Meaning. This was the placebo bibliotherapy group. The patients in the third group were not given any book to read. This was the no bibliotherapy group. All the patients in this study were over 60 years of age because the researchers wanted to determine if bibliotherapy would help older adults who are depressed. Okay, so that is all for Part 6, the preface to David D. Burns, the Feeling Good Handbook. If you like this content, like this video, and comment below. Thank you very much, and thank you for watching.